Veterinary Medicine Digital.
Renal diets have been a mainstay of treatment of kidney disease in dogs and cats for decades, but there is amazingly a lack of information about them. Protein content is only one of the components of a renal diet. We know that protein restriction helps decrease the signs of uremia in dogs who have moderate to severe uremia, but it's not just the amount, it's also the quality of the protein. A high-quality protein is one that has amino acids in the levels that would be used in the body, thus requiring less interconversion of amino acid to amino acid. Animal source proteins are the highest quality protein, with albumin being the highest quality protein of all, because albumin is the protein in highest content in our bloodstream. In addition to protein, however, phosphate restriction is probably one of the most important criteria for a renal diet. But in order to have a phosphate-restricted diet, you must restrict the protein because protein contains a lot of phosphorus. Sodium is also an issue with renal diets, but the exact right level of sodium is still a matter of controversy. On the one hand, excessive sodium restriction will cause activation of the renin-angiotensin-aldosterone system, and that can lead to hypertension and glomerular fibrosis. On the other hand, excess sodium supplementation in the diet may also cause progression of the renal disease. Omega-3 fatty acids have been shown to improve renal blood flow, but it's probably more than just the absolute level. It probably has to do with the ratio of omega-3 to omega-6 fatty acids. And at this point, it is not entirely clear what the most optimal ratio for those is. Thus, what it means is that comparing the protein content listed on the label of various diets is not an adequate measure of whether a diet is a good renal diet or not. Renal diets have been shown to slow the progression of kidney disease in both dogs and cats. In a study in dogs that were eating a maintenance diet lived median of 200 days compared to over 600 days for the dogs that were eating the renal diet. Similarly, dogs on a maintenance diet developed a uremic crisis necessitating hospitalization after a median of about 250 days compared to almost 600 days for the dogs eating the renal diet. And dogs eating the renal diet had slower progression of their renal disease. Similar study in cats eating the renal diet, there were no deaths and no uremic crisis during the 2-year period of the study, whereas 20 to 25% of the cats in the maintenance diet died of kidney disease or developed a uremic crisis during this period. Given the marked improvement in survival time and decreases in uremic crisis in diets, there is no other therapy that we have that is more effective than diet. By impressing upon clients the efficacy of this simple treatment, we can help encourage them to comply to our dietary recommendations. But patient compliance is also a factor in this. And if an animal will not voluntarily eat a renal diet, giving them a slower period of time to adjust, 4 to 6 weeks in some cases, to adapt to the renal diet is helpful. And if that's not enough, adding an appetite stimulant or placing a feeding tube is invaluable in managing these cases, because that allows them to eat an appropriate quantity of an appropriate diet. And with the feeding tube, it also simplifies medications and fluid administration, thus giving the patient a better quality of life.